Introduce yourself.
Hi, my name is Terry Cizik. I am the Director for Outpatient Services at Linden Oaks Hospital in Naperville, Illinois.
Okay, so what would you describe as the definition of body image?
Well, when I think about body image, particularly with the patients that I work with, I think about it as their perception of what they think about their body, the feelings they have connected to their body, and how they think about themselves in comparison to their peers.
Okay, and so in your field, does this really impact, is this a high contributing factor to the depression that you see?
I really think it is. We work all the time with adolescents who are depressed and anxious.
Stop! Say it again.
We work all the time with...
Stop! Say it again.
Too funny. We work all the time with patients who are depressed and anxious, and many of them are bullied, and some of that bullying is because of their bodies, and so they feel more depressed and more anxious because they're not accepted by their peers. Their low self-esteem is also impacted by their sense of their own body image.
And do you think that the media is a thing that really impacts it, or do you think it comes from in chemical imbalance, or...
I think there are many factors. I think one of them is certainly the media, everything from magazines to watching TV to videos, and trying to have that perfect body that just isn't possible. But I also think family and peers are also important, particularly for younger adolescents, particularly younger female adolescents. If they mature more quickly, they have a much more difficult time. And the same is true for boys who mature physically much later. I found those two extremes to be the most difficult for adolescents in comparison with body image.
Okay, and so if a patient is leaving your program, what's kind of a message that you want them to leave with?
Well, it's really more about balance and health and wellness, and so we try to really help them continue to grow in their own sense of positive self-esteem and accepting themselves both inward and outward, and that includes how they feel about themselves and their bodies.
You said that this was more common, the more body image sort of related problems were more common in females than males?
Overall, I definitely think it is, though I do think adolescent males are also really hit with body image issues because everywhere they look, they want to be more muscular, but at the same time thin, and that also puts them at risk for steroid use, and we've seen that in our adolescent chemical dependency programs as well.
And why do you think that it's more common in females?
That's a great question. I think that it may be more common in females just because there's just more emphasis on appearance for females and probably more emphasis on capabilities and abilities for boys.
Okay, and you said that you see it more early in females and later in that age, in the...
Well, yeah, I think what I said was if females develop more earlier on, and so if puberty hits earlier on for a female, it's much more difficult, I think, for her to adjust to that. And for boys, if they develop later in puberty, it's more difficult for them.
Okay. Just sum it up with a message of, like, it really all comes down to be yourself. And
yeah, I would say be yourself, accept yourself, work more again towards for balance and for health and wellness than trying to be perfect. And no one can be, and no one should try to have to be.